We're obviously in the midst of a global pandemic, and up until several weeks ago, people felt it was limited to China and then South Korea and a few other tiny cases here and there, and somehow people believe this could be contained.
But again, people are supposed to be staying home anyway. So some days I really wonder, we're just calling people and saying, you've potentially been exposed, you should really self-isolate. And people say, we're doing that anyway. And we say, okay, thank you very much. And we get off the phone.
In times like this, it's people first and it's care first. And I think we're hard pressed to make a decision that is solely based on economic, on systems.
The virus has been less unpredictable than human and policy actions. And I say that with some deliberation. And so therefore, what happens how these phases go will depend a lot more on the actions of policymakers and how they're implemented.
When the COVID hit Navajo Nation, everybody is like, we're just wanting to hear these certain words and we're not hearing them. We're just hearing about death and this fear, the concept of fear. And it just didn't sit right for a lot of people.
Done a very good job for quite some time now in documenting what people might refer to as disparities by race and by other factors. But what we need to do is move from merely documenting and understanding those disparities and moving into a framework where we're really talking about health inequities.
From a sort of humanitarian moral perspective, there's a moral obligation to care about the life of everyone. But from a sort of enlightened self-interest, I would say, yeah, this pandemic has reminded us if we can't help other countries deal with this, it's going to come back to us as well.
What you were seeing in this COVID-19 pandemic is also that a lot of the good examples of response have come from not so rich countries.
If we do not change our direction, we will end up where we're heading, right? So there has been long-term warning from our health scientists about the pandemic. However, we are not prepared.
I will do everything in my power as a vaccine researcher to make sure, and obviously I'm just but one researcher and one scientist, to make sure that we not only have a policy goal for preservation of life, but of preservation of joy.